Hello friends, in this video we are going to discover the top 10 countries with free healthcare 2024. Countries with free healthcare help build and support a healthier, more motivated, and more productive workforce. That lessens the economic burden on companies as they incur lower healthcare-related costs and fewer sick days. Again, with fewer health concerns or medical debts, workers are more likely to stay motivated and engaged, which increases productivity. That's why there's an increasing interest in countries with free healthcare, which can be of great benefit to both businesses and employees. So, which countries have free healthcare systems? Well, few countries offer completely free healthcare services. However, most developed countries offer government-funded universal healthcare systems to citizens and residents where most services are free or low cost. Watch this video till the end to know more about list of the top 10 countries with free or universal healthcare, considering accessibility, quality, and coverage of healthcare services. Kindly make sure to hit the subscribe button and press the bell icon before we start this video about the 10 countries with free healthcare 2024. Now let's dig deeper into each of the top 10 countries with free healthcare 2024. Number 10. Denmark. Denmark closes our list of top 10 countries with free healthcare. Denmark's free and universal healthcare system is government-funded through taxes and offers free healthcare services to all residents. The country's healthcare system is highly regarded for its patient-centric services, preventive care, and comprehensive access to medical services, including prescription medicine, doctor's visits, hospital care, and more. The Danish healthcare system is based on a principle of free and equal access for all citizens. Thus, the vast majority of health services in Denmark are free of charge for the users. Denmark has a tradition of a decentralized health system. However, during recent years, reforms and policy initiatives have gradually centralized the health system in different ways. Number 9. South Korea. South Korea is among the countries with the best healthcare systems in the OECD, funded through government subsidies and monthly contributions from both employees and employers. The Korean universal health system is accessible to all Korean citizens, residents, and even foreigners. The government-run health system covers 60% of healthcare costs, and the remaining expenses are covered through a private health insurance fund. Korea's health system is in very large part focused on curative, rather than preventive care. In many ways this is understandable. Mortality from chronic diseases, such as circulatory diseases, is still far lower than in many OECD peers, while overall rates of risk factors, obesity, smoking, even overall alcohol consumption, appear comparatively low. Number 8. Brazil. Brazil stands out as the model of countries that have free healthcare. The Brazilian free and universal healthcare system is funded by the government and is accessible to any person in Brazil, including citizens, legal residents, tourists, and even refugees and immigrants. Patients have access to free healthcare services at the point of care, including hospital care, outpatient care, vaccinations, surgeries, preventive care, and more. The Sistema Único de Saúde (SUS) is Brazil's national health system that reaches universal health coverage within the country. It is decentralized with administrative responsibilities at all levels of government, federal, state, and municipal. Number 7. Sweden. Sweden has made it to our list of countries with free healthcare systems because it has achieved universal health coverage with comprehensive healthcare services. The Swedish healthcare system is government-funded and is accessible to all citizens and legal residents. Residents have access to many healthcare services, including hospital care, maternity care, preventive services, primary care, specialist consultation, and dental care for children and young adults. The Swedish healthcare system has high public funding, universal coverage, and ambitious uptake of modern technologies in efforts to prevent unhealthy lifestyles. These attributes contribute to low levels of unmet needs, favorable health outcomes, and good health status in the population compared with other countries. Number 6. France. Listing countries with free healthcare is hard without mentioning France. Its universal healthcare system is reputed as one of the best in the world for accessibility, quality care, and efficiency. Healthcare services, including hospital care, prescription drugs, and doctor's visits, are available to all citizens, legal residents, and even visitors residing in the country for more than 3 months. It is a universal healthcare system. It features a mix of public and private services, relatively high expenditure, high patient success rates and low mortality rates, and high consumer satisfaction. Its aims are to combine low cost with flexibility of patient choice as well as doctors' autonomy. Number 5. Germany. Germany is among the countries that have achieved universal health coverage through a government-run sickness fund that requires all citizens to have medical insurance. Germany's healthcare system is funded through a combination of taxes, social insurance contributions, and co-payments. That ensures all citizens and legal residents have access to comprehensive high-quality medical services, preventive care, long-term care, and more. The German healthcare system is divided into 3 main areas: outpatient care, inpatient care, the hospital sector, and rehabilitation facilities. The institutions responsible for running the healthcare system include the associations and representatives of various providers and professions, health insurers, regulatory bodies, the Federal Ministry of Health, patient organizations, and self-help groups. Number 4. Norway. The Norwegian universal healthcare system stands out among countries that have free healthcare because of low wait times, emphasis on patient outcomes, and quality of services. Norway's healthcare system is funded through taxation and social security contributions and is available to all residents. Free healthcare services include hospital care, prescription medication, and medical consultations. Individuals looking for additional coverage and faster access to services have the option to purchase private medical insurance. Municipalities organize primary healthcare, while the national government is responsible for specialty care, including hospital services, through the state-owned regional health authorities. About 10% of the population has private insurance, mainly to gain quicker access to and greater choice of private providers. Number 3. Australia. Australia stands out among the countries that have free healthcare. Known as Medicare, the Australian free healthcare system is funded through general taxation and offers essential healthcare services to citizens and permanent residents. Residents have access to free basic medical services, hospital care, doctor's appointments, prescriptions, and some diagnostic tests. For high-quality services and faster access to specialists and elective procedures, Australians have the option of purchasing private health insurance. Australia's health system is one of the best in the world, providing safe and affordable healthcare for all Australians. It is jointly run by all levels of Australian government, federal, state and territory, and local. Number 2. United Kingdom. The United Kingdom has a free and universal healthcare system called the National Health Service, NHS, which is praised for its accessibility and efficient primary care services. NHS free healthcare services are structured regionally and funded by the government through taxation. All United Kingdom citizens and residents have access to comprehensive free healthcare services, including hospital care, medical consultations, doctor's visits, maternity care, mental health care, prescription medications, and more. All individuals, irrespective of their nationality or immigration status, are eligible to access primary, emergency, and compulsory psychiatric care, free of charge. Coverage for secondary care services, however, is only available for those who are ordinarily resident. Number 1. Canada. Canada tops our list of countries with free healthcare systems. Medicare, the Canadian universal healthcare system, is publicly funded and run by individual provinces and territories. Healthcare services are available to all Canadian citizens and permanent residents. Free healthcare services include doctor's visits, lab tests, hospital care, and prescription drugs. Canada's publicly funded healthcare system as dynamic reforms have been made over the past 4 decades and will continue in response to changes within medicine and throughout society. The basics, however, remain the same: universal coverage for medically necessary healthcare services provided on the basis of need, rather than the ability to pay. So, which is your favorite countries among the top 10 countries with free healthcare 2024? Well, that's all we have for you today. Thanks for watching. If you enjoyed the content of this video, click the subscribe button so you can receive more content like this. Post your favorite countries among the top 10 countries with free healthcare 2024 in the comments below. I'd love to read them and I'm sure others would too.